Chapter 9, Capillary or Dermal Blood Specimens. By the end of Chapter 9, you should be able to describe the reasons for acquiring capillary blood specimens for adults, children, and infants. List common laboratory tests for which capillary specimens may be collected. Explain why capillary blood from a skin or dermal puncture is different from blood taken by a venipuncture and the differences impact on the laboratory tests. Identify the proper sites for performing a skin puncture procedure and explain why it is necessary to control the depth of the incision. Describe the procedure for performing a skin puncture. Describe the procedure for making an acceptable blood smear or film. Indications for skin puncture. It is useful for adults and pediatric patients. Certain tests require small amounts of blood. For neonates and infants, use of capillary blood samples is the preferred method of collection. If small amounts of blood is acceptable for the laboratory test, dermal punctures or finger stick procedures are used. Conditions for dermal or finger stick. Patient has fragile veins. Veins are being saved for IV therapy. Multiple unsuccessful venipunctures and tests require small amounts of blood. Home testing, point of care testing, severe burns, obese patients, thrombotic tendencies, patient receiving IV therapy in both arms, patient is fearful or anxious about venipunctures, the patient may need only one blood test done on a small sample volume. Finger stick procedures are not recommended if the testing requires large amounts of blood, the patient has swollen fingers, is in a dehydrated condition, has poor peripheral circulation, or coagulation studies. Please see box 9-1 in the textbook. Composition of capillary blood. It is a mixture of blood from arterioles, venules, capillaries, intracellular, and interstitial tissue fluids. Collecting diagnostic capillary blood specimens. First steps for venipuncture procedure also apply to the skin puncture procedure. Preparation, identification of the patient, asking about latex allergies and fainting, hand hygiene, cleansing the puncture site. Subsequent steps are slightly different. Supplies for skin punctures. Disposable gloves, commercially available warming pack, heating pad, or device for warming. Sterile disposable single-use retractable safety puncture device. Disinfected pads or 70% isopropanol. Sterile non-latex bandages, self-adhering bandages, and gauze pads. Glass microscope slides. Diluting fluids as required by manufacturers. Plastic microcollection tubes, plastic-coated capillary tubes, capillary tube sealers or closures, laboratory request slips or labels, marking pen, puncture-proof biohazard discard container. Skin puncture sites. For adults and older children, preferred site is fleshy, central palmar surface of the distal phalanx of third or fourth finger of the non-dominant hand. Use the thickest part of the finger just off the center. Fingers should not be cyanotic, edematous, or infected. For infants less than 1 year old or neonates, use the lateral or medial plantar surface of the heel. Structures of the finger and nail. Note the positioning of the fingertip bone and where it lies. It's in proximity to the edge of the skin. Nails are formed like hair from a root and grow about 0.1 millimeters per day. The nail bed is tender, so punctures near the nail edge are more painful and not acceptable. Sites for dermal puncture on the fingers, the finger stick. In the figure A, the third and fourth finger of the non-dominant hand is the preferred choice. In figure B, note that the darkened areas or curved areas represent the most suitable puncture sites that avoid the risk of puncturing the bone or nail bed. Keep in mind that each patient is different and slight adjustments may be required. In figure C, the fingerprint grooves are often hard to see, but if visible, the dermal puncture or incision should be across the grooves instead of parallel to the grooves. This helps form the rounded drops of blood If the incision is parallel to the grooves, the blood tends to run into them and is harder to collect. Skin puncture sites not recommended. The earlobe, central arch or posterior curve of the infant's heel, fingers of a newborn or an infant less than 1 year old. Thumb, the fifth pinky or index pointer finger, swollen, infected, calloused, burned, cut, scarred, bruised, previously punctured sites or sites with rashes. Fingers on the side of a mastectomy. Warming the site. Increases arterial blood flow to the area. Commercially available thermal packs. Heated surgical towel or a washcloth heated with warm water to 42 degrees Celsius will not burn the skin. Washing the hands with warm water also helps. Lowering the arm. Lower the patient's arm. Fingers downward allows gravity to fill the capillaries in fingers. Cleansing the skin puncture site. Cleanse the site with 70% aqueous solution of isopropyl alcohol. Allow the site to thoroughly dry before being punctured. Skin puncture devices. Sterile, disposable, single-use, permanently retractable safety blade or needle. Puncture devices control for variable depth and length depending on the patient's age and weight. The average depth of the puncture should be 2 to 2.5 millimeter for adults and less than 2.0 millimeter for children and infants. Laser devices provide a smaller hole, about 250 unum wide and 1 to 2 millimeters deep. These are some supplies for capillary blood collection devices and tubes from 2 manufacturers. Basic skin puncture for the capillary blood collection. Follow the manufacturer's instructions. Remove the puncture device or lancet from the packaging. Let the patient know that he or she will feel a prick. Hold the patient's finger or heel in case of an infant firmly with one hand, with your thumb away from the puncture site next to the patient's fingernail. With the other hand, position the puncture device perpendicular to the site. Activate the release mechanism so the puncture is made quickly. Orient the cut across the fingerprints to generate a large, round drop of blood. Discard the puncture device in a puncture-proof biohazard container. Wipe away the first drop of blood with clean gauze unless otherwise indicated by the manufacturer. Collect the second drop of blood by touching it to the tip of the microcollection device. The blood will flow into the tube by capillary action, whereby blood flows freely into the tube on contact without suction. Gently apply pressure to the finger and hold the puncture site in a downward position while filling the tubes. Do not use excessive milking, massaging of the finger, or forceful scooping up of the blood. Follow the correct order of draw. Each type of microcollection laboratory test has a different tube and blood volume requirements. Follow the appropriate manufacturer's instructions. Carefully and safely seal the microcollection tubes as directed by the manufacturer. When filling capillary tubes, do not allow air bubbles to enter the tubes. Apply gentle pressure as blood drops are collected. Mix the specimens according to the manufacturer's instructions, usually by gently inverting containers with additives to mix blood with the additives. Blood smears can also be made from subsequent drops of blood. Using a clean gauze pad, apply gentle pressure to the site until the bleeding has stopped. Label the specimens and outside containers to prepare for transport. Ask the patient to confirm identity of labels. Discard all other biohazardous supplies before removing your gloves. Remove and dispose of the gloves. Perform hand hygiene. Ensure that bleeding has stopped. Thank the patient before leaving with the specimens and remaining supplies. This is the order of draw using the BD microtainer tubes. Filling each tube to correct fill volume is important. Underfilled tubes will have higher concentration of additives and can cause erroneous results. Overfilled tubes lower concentration of additives, anticoagulants, and may result in clotting. Causes of hemolysis: not removing residual alcohol at the puncture site, excessive milking, massaging of the finger. Patients have increased blood cell fragility and high packed cell volumes like newborns and infants. Excessive shaking while mixing. Blood films for microscopic slides. They are no longer performed in all laboratories. They're used to evaluate morphology, form, and structure of blood cells for detecting cellular abnormalities for confirmation and or as a backup method. They are prepared with a blood drop. Slides are stained and evaluated under a microscope. Prepare and assemble supplies. Identify the patient properly. Cleanse your hands and don your gloves. Perform the skin puncture. Wipe the first drop of blood away. Touch the slide to the second drop at the approximately half to 1 inch from the end of the slide. Place the second spread or slide in front of the drop of blood and then pull it slowly into the drop, allowing the blood to spread along the width of the slide. When the blood spreads almost to the edges, quickly and evenly push the spread or slide forward, not downward, at an angle of approximately 30 degrees. Blood films should have a feathered edge. No lines, no ridges or holes should be visible in the smear. Errors often result of too large of a drop, too long of a delay in spreading the drop, not moving the spreader slide in a straight line, pressing too hard on the spreader slide, blowing on the slide, or using a chipped slide. Label the slides and prepare them for safe transport to the laboratory. Discard unusable slides and all biohazard waste in an appropriate container. Label the slides according to correct ID procedures at your facility. Thank the patient for cooperating, reconfirm identity, and allow the patient to leave. Depart with all specimens and all remaining supplies. Transport and or deliver the slides to the laboratory. Supply disposal, labeling the specimen, completing the interaction. Used disposable puncture devices or lancets should always be placed into a rigid, puncture-resistant biohazard container with a lid. Contaminated supplies such as gauze, gloves, and other disposed of in other designated biohazard containers. Hand hygiene is performed after the contact with each patient. Before leaving the patient's side, check the puncture site to make sure that the bleeding has stopped. Thank the patient. Adhesive bandage may be applied. Bandages are not recommended for infants or young children. That's the end of chapter 9. Thanks for watching.